Hi guys, how are you? Um,
Hi, Chad. Good, thanks.
yeah,
How are you?
good, good. Um, I think let's give it like 5 minutes just to see how many others join. Hopefully, we hit at least 10 doctors or so on the session, and then yeah, we'll kick off. Chanel's gonna present. Um, it's a short slide pack, and then we'll just kind of get into the meat of how the virtual care platform works and how you guys can obviously make it work for you guys through your virtual clinic. So let's give it a 2 minutes. I'm just gonna make a coffee quickly, and then we'll see who else joins. Okay, and then we can kick off. Thanks, guys. Chat now. Bye. Hi guys. Okay, I think we're only gonna get to 11. Chanel's just busy logging in on her side to share the presentation. We're having some technical issues. Um, just give us 1 second.
Hi, everybody. This is Chanel. I am having some difficulty sharing my PowerPoint, but I'm going to sort it out. What I was thinking in the meantime is because I haven't met any of you yet. I actually see a familiar name here, Erica Bantham. Um, I was thinking that if we
Hi,
can maybe.
Chanel.
Hi, Erica. How are you? I was thinking if we can just introduce ourselves because I haven't met any of you and some of you haven't met me before. And so I was thinking just say who you are, where you come from, and if you've used telemedicine before. And then if you've been on one of Marlon's sessions before, he always uses this like a check-in where you say what number you're feeling, like 1 being terrible and 10 being amazing. So I was thinking if we can just share how we're feeling in the meantime, while I am going to get my PowerPoint onto this call. Okay. So if we can, I don't know, Danica, if you can maybe just read out the names on that cohort list and then we can just go in that order. Is that okay? The cohort that you sent me, the list of the people that should be on the call. Hello, Danica? Oh, you're not staying in the call. Okay, I'm gonna. Erica, maybe you can start. Maybe I see that Danica isn't able to assist us. But maybe you guys can just start and then I'm gonna try and get my PowerPoint to share after after we've all introduced ourselves. Erica, do you want to go first since I know you?
Sure, no problem. Hi, Chanel. Sorry, I'm just trying to close the door here. Okay. Hi, everyone. So my name is Dr. Erika Bantham. Chanel was my mentor in first year. Full circle, you're mentoring me again now. So I am living in Manenberg currently, studied at Stellies and post-comserve. I'm a 8. Yeah, I'm excited for this session, but of course it's been a day. But I am quite excited about the telemedicine session. So I haven't done it as a doctor, but I've been a patient in telemedicine. Yeah, so not as a doctor, but definitely as a patient. It was a easy process. But I'd like to learn more from the other side of the screen, of course.
Thanks, Erica. Anyone else that had any exposure to Telemed or used it before at all?
Hi, I'm Azhar Anwari. So I've worked at a practice that used telemedicine, I suppose, just with telephonic phone calls for consults. and we also did a few like video calls with patients. Yeah, and then that's pretty much it.
Cool, brother. Thanks, Azza. Yeah, now it's definitely starting to become a little bit more. I guess it's actually more accepted by the patients. I think some of the doctors are still getting used to it. But yeah, anyone else that's used it before, or either as a patient or as a doctor, either way.
Hi guys,
Khadija?
I'm
Hi, Khadija.
Khadija. I'm also post-consult. I've used telemedicine for patients in the form of calls and video calls as well. Yeah.
So you guys did so you did sort of sessions with patients, like video call sessions, but not a specific telemedicine platform at all.
It was via the EMD software.
EMD. Okay. Okay. Cool. Cool. Anyone else?
Before you guys carry on, can you?
Um,
Sorry, guys. Can
We
you
can
see
see.
this?
We can see this,
Great. Okay. Thank you.
but it's as
So
a
we can
PDF
just.
though. But yeah.
I know. I can't get it now to the PowerPoint. I'm gonna
Sorry.
just go through it.
Yeah. Okay. Sorry for cutting. You can go.
I'm Melissa, and I don't have any experience with telemedicine as a patient or as a doctor.
Okay. Cool.
So I'm excited to learn.
And
Okay.
Melissa, how are
Cool.
you feeling?
About a 7 out of 10.
That's good.
That's not bad.
Yeah, yeah. I'm keen to learn about this whole process,
Awesome.
and yeah, my mind is filling up with a whole bunch of ideas, but
That's
yeah,
good. That's what we want. Yeah. That's
yeah,
kind of the point, right? So it's more just to kind of spark the ideas and understand how this is going to fit into your business, and yeah, and just sort of what the scope is and what the scope looks like in the country at the moment, because things have changed a lot.
yeah,
Yeah.
definitely. I'm excited.
Anyone
Looking forward
else?
to the session.
Yeah,
Great.
no, us as well. So you guys, so the first cohort, so we had obviously the previous cohort that rotated through. We actually didn't do this session in this week, in this practical week. We actually did it a bit later, because Chanel unfortunately fell a bit ill. So we had to postpone that session. But it's good. It's good that it's happening in this week, because we want you guys to set up your profiles and start reaching out to patients and trying to build your patient base. So yeah, so it's a good thing that it's happening now. Shana, I think you can share the screen so long. If anyone else that has any comments on having used it or not, it's good to hear. Some have, some haven't.
And been
Um,
patients before, which is great because you know what was irritating to you
mm.
before. Okay, does anyone else want to just share for the next minute and then we can start?
Hi, I'm Dominique. I've never used telemedicine as a patient or a doctor before. I'm from the Bellville area, and then I'm like a 7.5. It's been a long few days, but I'm
Yeah.
excited to learn from Chanel.
Dominique, do I know you too?
Yes, you do. We did
Your voice.
internship together.
Yes, your voice sounds familiar. And yeah, I'm looking at your surname now. So I know two of you. And is there anyone else? Nice to hear from you again.
Nice. I'm glad you're doing better.
Yes, no, I'm good. I'm good now. Chad makes it sound very dramatic, but
It was
I
dramatic, guys. I found her unconscious, unresponsive, GCS 3 out of 15 in the bathroom. So it was quite. she
yeah,
she wasn't there. Well, she
I
was,
wasn't
but she
there.
wasn't.
But I'm
No,
okay now, thank you. So that's why this was a little bit delayed for the previous people. Yeah, you did save my life actually. um, is there anyone else who'd like to go before we carry on? Okay, I take it not. And then I think we would, because I wanted to get to know you guys, but I know it's so many of you all the time. But I'm gonna share my screen now. And the reason I'm showing the telehealth versus telemedicine, is because if you've been exposed to it before, telehealth is very it's a more encompassing experience for the patient. So it's not just a virtual consult and then it's done. We actually have tried to focus on patients holistic well-being and focus on from where they work to where they find themselves at home. And our main thing was to make healthcare accessible and affordable. So when we started with the app, it was an Android app initially, and it was just like virtual care, and we had some symptom checker things added, and we had some extra things added, but we actually wanted to go back to making it simple for patients and for healthcare providers. And then we launched as an Android app, and this posed lots of issues in terms of doctors not having Android cell phones, and all of our patients had Android cell phones, and the doctors all had iPhone. So obviously that was going against our accessibility. And then we relaunched our web-based platform. So I'll show you a little bit about that now. And it is called My Pocket Health. And we developed it with South African developers who understand our healthcare system and who understand us, because initially we had some Indian developers, and it was very difficult in terms of communication, and they were not from South Africa, and that was very challenging. I was part of that process initially back in 2021. And then in 2024, we launched our web-based platform, January 2024, which means it is a web app. So patients get a link and doctors get a link. And we can then access each other from any device, any laptop, any MacBook, any cell phone, any tablet. And we wanted it to be more accessible. So when we launched the web-based platform called My Pocket Health, we launched it alongside a product that we will enlighten you guys on, which is called Work Care. And that was, we added diverse applications and education and monitoring tools, in so that we can actually help a patient holistically. And where the origin of this creative idea came from was, this was me, if you can see that over there. I was on maternity leave, and I was sitting there with my baby, breastfeeding, while seeing a patient on my Android device with my Mac next to me, making my notes, but also using my Android device, because this was now when it was still Android. And I was on maternity leave, and I was sitting there and doing my consult because I, still needed to earn money. And I was fine doing that. My patient saw this, and my daughter saw absolutely nothing. And she was happy, the patient was happy, I was happy, and we were, just carrying on with life, not letting anything stop us. But that was then, having this Android device. So there were lots of limiting factors. And then came 2024 when we launched our web-based platform, which then now can go on any device, and patients and doctors or any other healthcare providers log in using a link. So that's what they would do. And this was just to cover what telehealth versus telemedicine is. So when I say telehealth, I want patients to, replace it with their Dr. Google, to actually access it and speak to us when they have a question, when they have a rash, when they are sitting in their office and they need their updated prescription for their contraceptives, but they can't get to us. We want it to be there, you just there, just a hand away, the healthcare must be in their pocket. And that's why we called it My Pocket Health. So it must be for holistic patient care, and then enhancing the accessibility, making it on any device. Then And as you can see here, provider.mypockethealth.co.za, that is the link for providers to log in. And we really want this platform to be like your virtual clinic, wherever you are. And the reason I showed you my maternity picture is because I was sitting in the house and I could not leave because I had a breastfeeding baby. And this was 1 month postpartum, by the way. And I could see my patients from anywhere. So we really want this to be, where you can see a patient, create their health record, have them pay, have everything all in one place without needing multiple devices and multiple, like other tools, other things to bill and those things. So we wanted it to all be. So this is literally your prescription pad, your referral notepad, your medical certificate pad with your details on all in one platform. And I'm not sure how many of you, I didn't get a chance to go through how many of you have actually, who are on this call, who have actually registered already. But when you register, you will click on this sign up now button, and then you'll put in your name, surname, email address, create your own password, because obviously it needs to be password protected. And then you will upload documents that you probably have uploaded when you applied for Shlola. You would have uploaded the documents, so you don't have to re-upload them, because we would have seen them already. And then you can just submit, and I will get it on my side. And then because you are part of the Shlola program and your documents would have been in order, I will then verify you, and then you will be able to log in. And then you log in and it says, welcome, Dr. Erica Bantham, and you can create your slots, and you can check your schedule. So we wanted to make it as simple as possible for our patients and our providers. When I'll show you the list of providers now, but it's not only medical doctors. It is also open to mental health counselors, dietitians, physios, any healthcare provider who would need a platform to access more patients, to access their patients on, as another form of income. And so we made it available to all healthcare providers. When you log in, you'll see here that it says settings on the side. So when you log in, you'll click on the three lines over there, and you'll go in and click on settings. And you can see that you can change your consultation charge. You can update your signature. You can change your password, all of your settings that you would need. You can also update your profile. So please update this bio, because this is what patients would see. They would see, I am Dr. So-and-so, and I enjoy women's health, or I have a special interest in mental health or men's health or anything like that, because that's what your patients will. So this is like you marketing yourself to the patients on the platform also. And they would then decide which doctor they would choose, unless it's your patient, and they will know your name and they will choose you. And then they will see you there with your details. You can also create a profile picture. Then when you go in, you will create your own slots. So this is also what is important as a provider, that you're going to be doing your ultrasound, your sessions with the practices where you're going to do the ultrasound slots and those things. So you can actually determine what your day would look like. So you can say, I'm going to be online from on the 3rd of September from 8 a.m. to whatever, 12 p.m. And you'll see here that it says 15-minute slots. So you can choose 15-minute slots, 30-minute slots, or 60-minute slots. The reason we've added those different amounts, durations of slots, is because patients can reach their mental health counselors, and mental health counselors or dietitians actually need a little bit more than 15 minutes. So we've made it available to them, but you can then choose. You will be available from 8 p.m. or 8 a.m. to 1 p.m. if you need to go and get the kids at school, or you need to do some other meeting that you have booked. So you can actually set your availability. And then when the patients then come online on their login link, you'll see it says patient.mypockethealth. They will see the list of healthcare providers. So this was a screenshot. Yeah.
Chanel, can I just so just go up quickly? So guys, so I just wanted to add a few things quickly here to what Chanel was saying. So if you remember from our sessions, right, the first few days, I just want to highlight this quickly. So when we built My Pocket Health, right, the main reason we created this thing was really genuinely for doctors to create a virtual clinic. That's why there's two sides to the platform. So if you look at 90% of virtual care type things, it's usually just one-sided. Either it's like if you use, let's say, Kenna Health. I'm sure some of you have heard of Kenna Health. That's a customer-facing or patient-facing platform. So that basically you go onto. There's this, you can chat with them or script usually, but the model is very different in that they employ nurses and things on the back end of that. Okay, so it's very much just patient-facing. And then there are some health record systems that do offer some sort of virtual care thing. For us, this is a platform that was always there to have doctors on the one side, patients on the other side, so that the doctor can sort of run their own thing off this. And I think it's very important just to stress that as we're going through it now. If you remember, we spoke about when you go to Mediclinic and you walk into Mediclinic and you going there to see your doctor whatever, maybe it's your gynae or your physician, but you going to Mediclinic or Intercare or Netcare, sorry, to see them specifically. But when you enter, there's a board full of doctors, and then there's a whole list of them. But you're not going there to any of them. You're going there for your doctor. So the same applies here, in that when you're building out your profile and your, I guess you could call it virtual clinic brand, it is yours, right? It's what you push out to your customers and your patients, and we will use customers because as we spoke about in our previous sessions, customers are not necessarily just patients. They are one of your customers, SMMEs and corporates, etc. They're all customers. So what your customer sees is, yes, they will see other GPs and other doctors and whatever, but they're coming there for you. They're your client. So that's very important for you guys to understand. And sort of, if you think about that comment we made, we asked about how many people have sort of just messaged you. They message you, Dominique, like, "Hi Dom, my head is sore. What do you think I should do?" And you being a nice doctor and a good friend, you just respond and say, "Don't stress, don't do this, don't do that." But that's supposed to be that's a transaction there, right? So My Pocket Health is fundamentally a transaction medium for you to deliver your healthcare services and get paid for it. Okay, so that's really one of the core tenets of the virtual care platform. It was built by us from the ground up with the almost exact, I guess you could call it, workflow that we have as South African doctors, so that it feels natural. Okay, so that's just something I just wanted to give some meat on. And then the other thing with regards to these additional service providers, like Chanel said, we added the you can physios and counselors and dietitians and everything. It's used, why it's there and why it's important and useful is that you can collaborate with other healthcare allies on the platform. So if you have a patient, let's say you start building your patient base up, and you identify that you've got quite a lot of diabetic patients, for argument's sake. That's a chronic disease management approach. So we'll get into some detail. I'll give you guys some very cool examples of what you can do, what we encourage you guys to do. But you can then offer holistic care, knowing that you've got partner allies on the platform too, that your patients can engage.
It's like a one-stop shop.
It's a one-stop shop, yeah, for you and for the patient, right? So see this platform as genuinely like almost like a house or like a hospital or like a. If you think of Medicross, you walk into Medicross, there's a bunch of GPs all over. Kind of look at it like that. Like the platform is nothing more than a roof over your head, in inverted commas, with all the tools and things that you need to. We'll get to the customer acquisition and acquiring patients and all those things now. But just in your head, in your framing, this is your virtual home where your own GP practice or primary care practice exists. And If you remember, we spoke about the engine room. So when it comes to the GoGP model, engine 1 was the POCUS as a service. Engine 2 is the virtual care, virtual clinic where you build your own customer base. And then engine 3 would be all the other stuff you want to do, like locoming. And if you want to become a thought leader, goes Chanell does talks and then she charges the people 10 grand a talk. That's all engine 3, right? So those are all the additional things, because remember, your trust, your social network and your trust network is what is your value in the market, in as a doctor. So this is engine 2, and engine 2, you deliver and you benefit of engine 2 by using virtual care, and you're using My Pocket Health as the platform. Okay, so just wanted to give you guys that framing before Chanell continues into. So we'll do the technical stuff and we'll go through the platform, we'll show it. But we'll just make sure as we go, we'll just tie in some of the practical stuff on the business side and the commercial side also.
Yeah. So I just, from my side, I just want you to get a good understanding of what you are signing up onto and what it looks like, and so that you feel comfortable. So that's why I'm going through it. And also, if you've been on the patient side, you know how easy it was or how frustrating it was. So when we relaunched it as a web-based platform, we really wanted it to be very simple on both sides. So that is, thank you, Chad. So I'm going on to the patient side now, just so that you sort of know what the patient is looking at. It's not the same as yours. So theirs will be patient.mypockethealth.co.za. So it's completely patient facing on this side of the web link. And it will say welcome with their name. This is just the test profile that I'm showing you now. And they will click consult healthcare professional. And when they click that, this will pop up, and all of the providers who are available will pop up. At the moment, we've got 51 healthcare providers on the platform, which some of you will now form part of once you sign up onto it. And they can then go through and say, oh, there's my doctor. And then they can click on your name and they can see what available appointments you have. So then they will click there. You'll see here that they have access to their health records and they're managing their bookings. They will then click on their doctor. Then they will click on your available time slots. So here you'll see it shows the date and your slots that you have now set available. So then they'll click one of them and then they will go through. It will come through on the doctor's side. On their side, it will show they can click, is this appointment for themselves? Because we've noticed that a lot of the times, I'm getting to the work care part now as a product, but a lot of the times it's actually the staff members, kids who need a consult, or the grandmothers who need a consult, or the cousin who needs a consult, and then they can actually just access it from the platform. And that person might not necessarily have an email address or a cell phone number. So then here they can actually click, yes, it's for me, or no, it's not for me. And then it will come through on the doctor's side. Then the payment methods are also that they can choose here. Voucher, Zlato voucher, which will go into vouchers now. Or we'll go into that soon, but there's Zlato voucher, which is a platform that we've partnered with. Then they can pay with their card or EFT, SnapScan or Scan to Pay, or if it's corporate, and that I'll touch on now when we get to the work here part. So they'll choose their method of payment. I just wanted to show you here that it does, they can put in card details or they can use SnapScan. So we really tried from all access points to make it available to our patients to access you as a healthcare provider. And then they booked their consult. So there you'll see it says booking completed. Your booking has been successfully completed. And now they will wait. On your side, you'll see the booking and you will click accept and you will then view your booking and you can start your consult. You start your video. So here I was having a consult with Mrs. Orchid, and we were chatting, and I could, ask her everything about what's needed, or how purple her flowers are, how much she's blooming, how much water she needs, all of those things. And then we'll end the consult and you can then put in your consultation notes, your prescription, your medical certificate, and even your referral notes after the call. This is on the patient side that they'll be able to access this health record, and they will to note, the patient sees your consultation notes. So even if you are writing shorthand like HPT for hypertension or GERD for GERD, it doesn't have to be understandable to the patient, but it needs to be understandable maybe to you or to the next healthcare professional who actually sees the notes. So it's just that we wanted patients to have their health record wherever they go, which helps for continuity of care. And when the next doctor sees them or the next mental health counselor sees them, they actually can get access to the notes and they can see what has been done. Yeah, I just put in an example of what the prescription actually looks like once you type it. These are all, something weird happened here when I uploaded it, but these are all pre-added. So it's a template that we've developed using your details that you have put on your profile. So remember in the beginning when I showed you the settings, you will create those things. So you will put in your name that you want displayed, your practice number, the telephone number, the email address, the address itself. You can put in whether you are like Dr. Smith and Partner is who we are. You can put in that as a practice number, then your HPCSA number goes there. All that will be auto or filled by you is your diagnosis, ICD-10 code, your description of the medication that you are providing, and then the quantity. And your signature is already uploaded. So if you have done your settings and your profile initially when you are registering, all of these things will be pre-populated for you. So you don't have to worry. So when you put in a cell phone number, try not to put in your personal cell phone number, because this is what will go to the pharmacies and what patients will see. This is everything that is actually required legally for a prescription to be valid. The only thing I'd like to just note here while we're on the prescription is the only limitations to these virtual prescriptions is that you cannot prescribe Schedule 5 and 6 medication on a health record that goes to the patient, because that needs to go directly to the pharmacy. So then you can either do it on here, but you'll then need to email it directly from yourself as the doctor to the pharmacist. That's the only limitation currently in terms of virtual care. And then that will need to go directly, because obviously when you see a patient in person, like in a traditional brick and mortar facility, you would write out that prescription. But now you are not with the patient, so it will have to come from your email address when it is a Schedule 5 or a Schedule 6 drug that you are prescribing. This is what the medical certificate would look like. Your name again, all of your pre-populated information, the person's name. So test person was consulted by me on this date and this date, and you acknowledge and you putting them off from work. Don't worry, this is not what it really looks like. I think it just got a bit confusing when I uploaded it. But your signature's there, and it's everything again required for a legal medical certificate. This lives on the patient's health record, and then the referral letter is also whatever you've written, your notes. Here, I'd like to just add before I go to the products and how to actually, make money from this, is in terms of if you see a patient virtually and you think that you've maybe set up, relationships with doctors in that area where the patient lives, and they need a blood pressure check, or they need kidney functions, or they need an abdominal exam, and if you're really worried that you cannot make this diagnosis fully virtually, you can then write your referral letter on the platform, and you can say, dear Dr. So-and-so, kindly assist with this and this. Or if this patient needs to go to the lab and you really want to check, they maybe want their chronic prescription renewed, you can say, dear Lancet, or whichever lab they're going to, please assist with doing kidney function, so UNE, HbA1c, fasting lipogram, or everything that you require, you can actually type that here. So that there's that connection between you and whoever the patient needs to see next. And then it stays on this record. And like Chad said, it's a transaction that's happening. So obviously, we've always been taught like record keeping is the most important thing. So everything actually lives in this platform. Are there any questions before I go to the product called WorkCare?
No, I think just explain to them, explain the when it comes to the scripting, so we built in a little scripting formulary thing, which basically makes those things like neuromodulin, etc. Just explain that scripting part to them, Chanel.
So you actually, it's not a drop down that we've added to the prescriptions. The ICD-10 codes, these here that you see, diagnosis J06.9, that is the ICD-10 code. So most of us, if you've been practicing long enough, you actually pick up on these things. Sometimes if I don't know, I honestly just Google it, or I write, influenza, or you can actually write the diagnosis. You don't have to put in the ICD-10 code. But you can put in the ICD-10 code there, because obviously that's what's needed for a prescription when it goes to the pharmacy, or you can put in the actual diagnosis. And then with the description, we write it out. It's not because I've now been using the virtual care, so on my profile, certain things will pop up for me. So the more you actually use it, it will actually, pre-save all of those things that you have already typed previously. So Mybulin orally, 2 capsules, 8 hourly, pops up for me already, because I've prescribed it before. Or loperamide, Prodium, or Buscopan, those things. It's common, again, like we learned in med school, common things occur commonly. And when patients see you virtually, they know that they shouldn't, they don't necessarily need to go to the EC. It's not something that's like a red case that they're seeing you for. It's more those green patients that, need a script for something specific, or there's just a flu or gastro or things like that. So it's most of those green patients who fill up the ECs and wait for days to see a doctor. This is what we're trying to alleviate. We're trying to have patients access a healthcare provider affordably, and just to access us a little bit easier. And then the quantity will be how many tablets they need to give. So it's not, you're probably thinking there's a drop down thing, Jad.
Hmm.
So there isn't a drop down. It's just the more you use the platform, your pre-written notes will pop up. But we don't have a drop down thing as yet, because it can be anything. And to plug that into the app right now, we really wanted it to be as simple and user friendly for both the doctor and the patient. So we've made it simple enough for both sides, the same way you would have written out a prescription like with your hand. You would just type it out on this prescription pad that is pre-populated with your information on it. Okay.
So I just want to answer Melissa's question. So she asks, how does it work when you refer a patient to another practice, for example, examination? Would they then have to pay? So this is very cool and a very good question. And really, the exciting part of it. So if you remember now, if you think back, what's the main difference when you're going and you're locuming somewhere? We spoke about it in the last session. The only thing you're selling when you're going to locum is you're selling your time. And the only reason you're selling your time is because that practice already has an established customer base, patient base. So on this side of the business model, you are now in the business of building your own customer base, and you're building your patient base. And that means that along with the patient base you're building, you're also building out your networks and your relationships and so on. So Melissa, as you're building your customer base and your patient base, you will then also start building up relationships with doctors. So ultimately, you would then. So there's two ways you can look at it. Either you could we encourage this, but is to have relationships with various GPs around you and around where most of your patients are. Because if you remember, when we're looking at customer acquisition, the two sides of it, there's broad and deep. So we're gonna focus on deep first, which means you're gonna start with friends and family into your community. That before you start, creating big social media campaigns and things to reach customers all over the country. But you're going to start building those relationships. So when it comes to pricing and costs and things, this is now where you can create your commercial model. So you have a price. Let's say your price is 400 Rand a virtual consult. If you doing a virtual consult, like Chanel said, most of the time, 80 to 100% actually of the time, It's something simple. It's reassurance. You can ask the patient to feel themselves, examine. So before we built the platform, in my internship, in my last 3 months of internship, I was piloting the thing, right? So I already had a framework, and we started already back in 2018. I think was it 2018 Chanel, when I started working? Yeah,
Yeah,
18, 19, somewhere there.
2018.
For the concept of what My Pocket Health sort of is and became. And in my last 3 months in a public hospital, I didn't touch a single patient. Like, don't tell my consultant, but I was on Family Med, and I was doing all my consults basically across the
Virtually.
table, if that makes sense. So, and I didn't miss a single appendix. I didn't miss a single, urgent or emergent thing. These were all green patients coming to the day clinic thing there. So, and even at that sort of level of the market, right, where it's young kids, sometimes, 16, 15, 16, 17, coming with abdominal pain, etc. I was able to get them to elicit, clinical signs on themselves. And another thing that Chanel failed to talk about earlier was when you, or failed to mention, sorry, when with this virtual care thing, uh, you can actually take your care into where the patient is. So you'll take it into their home. You can see their pilichis, you can see their fridge, you can see when they're lying to you about if they're taking their meds or not. So when you're doing these consults with these patients on a virtual level, history, etc., will be the bulk of where you're getting a diagnosis. And then we encourage to push for sort of some sort of self-examination just to help you. But if you're really now uncomfortable and you think, okay, maybe the patient does need an examination, the idea is not for the patient to pay again. You need to have relationships and networks with doctors and allies, etc., on the ground. If you don't have your own facility, which for now you guys are not going to have, you're going to be hybrid, you're going to be virtual, you're going to be remote. Then you remember, if you look at the customer value proposition, that patient, that customer that you're seeing, the value proposition to them for you is that you're accessible and you're cost effective. If you now have to bring in another person that they must pay for, that becomes a challenge, right? So now that's defeating your value proposition. So how you would look at it is, say, if you have these types of patients and you have GPs, you agree on a number with him. Say, guys, I'm seeing these patients virtually. If I collaborate with you guys for, just coming in, doing an examination, let me know. And then you agree on a rate with them. That's going to have to come out of your pocket, okay? Because ultimately you don't want to burden the patient or the customer. They must perceive it as a seamless experience. So for the most part, that will be the rare instance. That will be now and then if you need to. The other side of it is, if you want to, if you're getting to that point and you're really pushing this thing now, nothing stops you from collaborating with a nurse or even a community health worker that you can equip and train to do things like you can literally, one of the doctors in the previous cohort, he said, can I put someone like in a room somewhere, in an area that people can go to for bloods and HETs and things. And I said, of course you can, but it's gonna impact your pricing and your margin that you make, the profit you make, because now it's additional resources that are needed to deliver that service. Yeah, so I think, Melissa, I think when it comes to thinking about these things, right? The beauty is in that with the tools and the things we've gone through and looking at approaching product, customer value proposition, all these things. That's sort of how you can come up. There's nothing's prescriptive. It's not we say it is so, isn't so, or anything like that. It's a case of where you find yourself in your reality with the market that you're in, the patients, the customers you're serving. How can you use the tools you have, like the virtual care, knowing what it does and how it works? How can you then create a model that has value for both you and the customer, and that removes barriers? So yeah, I think that's something just to consider, Melissa. I don't know if I'm answering that question properly, but that's how I'm kind of looking at it. You don't wanna let them pay again per se.
Mm.
Um,
What we
you wanna make it barrier free for them.
What we currently, because obviously within our practice, we've now tested this a few times and we've done it now a few times. But when we need, like, honestly, out of all the virtual consults that I've now done on this web-based platform now, since January last year, I think like maybe 1% of them needed to come in for something. And because we've got a hybrid model currently, and we've got the branches in Woodstock, Mitchellstown, and Tiger Valley, I could send, because it's, I still have to ask those doctors who are there, can I send a patient there for a urine dipstick or an HGT? And then we agree on a number like 50 Rand or something. But we don't, as an example, but we don't necessarily want the patient to pay another consultation fee. And honestly, most of the time, it would be reassurance that you're giving the patient. And when you prescribe something, I would often say, if you're not feeling better, within 3 days or so, then let me know and we can decide from there. But it's that relationship with your patient, and I think that it's not. Yes, it does all come back to your network, which is what we're trying to help you guys with from the beginning, or trying to install that in you from the beginning. That it's you are the business, and it's not necessarily that you are. It's about creating that network with people around you. And then just the next, I'm hoping that answered. But with the next question, can we do chronic scripts with repeats? You can say what the chronic medication is, and then you can say repeat times 6. I have done that a few times as well. The only thing is that if you are doing it, and it's maybe the patient has had their chronic bloods done in January, and they've at least had it done once this year, I would also just say, can you maybe just go to like a Dischem or a Clicks, or there are sisters there, like they can actually just do a blood pressure, and then I'll ask them to send me that result, and then we'll decide on if they're going to continue with their medication the way it is. And then, but you can definitely do chronic scripts on there, depending on what the chronic thing is. Like if it's high blood pressure, I would ask the patient just to go and check their blood pressure one more time, and then also that's where your referral letter comes in. So you'll add that. But most of the time, if it's been a stable, well patient who's been taking their medication, they just need to continue. You can always just repeat it. And then Menintle is
I just want
asking.
to add there. Just want
Mhm.
to add there. So as you guys, so I'm sure you guys are picking up like the fact that the healthcare system in our country, wherever you are, Cape Town, Gauteng, KZN, it is an ecosystem, and I think the idea when it comes to things like locuming and selling your time and sitting in a practice, um, it kind of shuts you off a little bit from what's happening in the market, because you are there obviously the whole day, well, most of the days when you're doing these locums, and your reality is kind of just in and around how that practice works. So you coming there, from a labor point of view, your value proposition, and this is why I always bring it up, because you must start thinking in value propositions, because the I think it's the determining factor for why people do things. Everyone is out there to get value for themselves. So, in the context of, for example, using locuming now, where you're selling your time, you are selling your time to that GP practice owner. Your value proposition to them is that they don't have to employ you, and it's only for a short period of time. That's one. And the second thing is you can see 10 patients in the hour, but you're only gonna get paid for your hourly rate. So from a value proposition point of view for that practice owner who's now, remember, already built up the patient base and all that stuff, from a transactional point of view, it's in his or her interest for you to be there. They benefit ultimately if the practice is already established. For you, the value proposition is that you coming in there, you don't have to think about anything in the context of traditional now. You don't have to think about anything, whether you see one patient or 10 patients. In that moment, the value proposition to you is that you're going to be making your hourly rate.
Mm.
And you have no other responsibilities other than seeing those patients for those few hours and leaving. So when you think in value propositions, when you enter the market now, you realize you're going to start realizing that you need to operate from a position of creating value for yourself and for the customers and the patients and the system at large. So Chanel made an interesting point there about collaborating with, even like clicks and so on. There's providers and infrastructure all around you. You will be surprised. You might even end up building strong relations with a pharmacy around the corner from you, where you have a relationship there, you start doing a transaction. You must go in with a mindset of, my value to the market is that I'm a doctor with an incredible brain and a lot of knowledge and a lot of experience and a specific thing that the market wants. That is what you must think of yourself when you wake up in the morning and say, what is my reason or my value in this healthcare ecosystem? Ignore what the market makes you think you feel about, there's no work and yes, there are some realities, but ultimately you must wake up in the morning remembering the fact that you are one in a very small percentage of people in the world and in this country who can do what you do. Okay. So what we're trying to do now is just to get you guys to think about the distribution of what you've been gifted and blessed with to be able to do, which is see patients, reassure. Remember, we asked in session 1, if you remember, the first session, I think we asked, I know a lot of you guys weren't on it, but if you were able to catch up, in the first session, we asked, what is your value proposition? Okay, you guys were actually good, but in the first cohort, a lot of the doctors said it's healing and seeing patients and care. And the reality is that's not your value proposition. In the context of being a doctor and delivering healthcare, that's your job. That's not your value proposition. Your value proposition is, how good are you at finding ways to deliver that care and that, etc. That's the biggest difference in the value proposition. So all these things and these mindsets and the tools and stuff, it's more for you guys to start really reflecting on where you're finding yourself in the market and how desperately the market needs doctors like you guys. And that's why we're here. Desperately needs doctors to start taking the market like head on, like going into it instead of receding back and waiting for the market to do something for you. I really think it's important that you guys and I hope that resonates with you guys. If it does, yes, put it in the chat or not, but I hope that resonates with you guys. You guys are incredibly blessed with very unique skill set and experience and knowledge base that patients and the market and customers are yearning for. They need it, they want it. They just need you need to put it out there and make it available to them. Because they only go, I think the biggest sort of oversight from a doctor's point of view sometimes in the market is assuming people understand what you understand. So patients, the layperson, they don't understand and see things the way you see things and know what you know. And they hold you in very high regard. And that is that social capital we spoke about. Okay, so yeah, I think Chanel answered the question but if that resonates, pop it in the chat. That would be cool. But yeah, that's I think that answers the first two.
I also just want you to think about you being like a connection for these patients. And the more touch points the patients have with you, the healthier and the more informed and the more empowered and the more educated they will become. So a lot of the times when I've seen patients, it was mostly to reassure. And then sometimes it was for actually they wanted a more affordable way of seeing a doctor to refer them to somebody, whether it is a public sector specialist or a private sector specialist. So further than a GP, so like a specialist referral. And I literally had this the other day where a patient was so grateful. I was very surprised because I have very young patients on the platform, but she was already in her 60s and she used the platform so well without asking for any help. She actually booked, she paid, she saw me, she got everything, she got a health record and everything. But she booked a consult because her knee has been giving her a problem. And a few years ago, a specialist said she needs surgery and she couldn't afford it. Now it's acting up again and she just needs a referral. So obviously, I didn't examine her with my hands because I saw her virtually, but I could look at her knee on the camera on the video call and I could see if it was swollen or if it looked deformed or if there's any redness, and I can ask her to touch it and feel if it's warm, and I could actually make make the referral on whether it's Vula or Tigerberg has this ortho online platform where you just need to think broader than you just sitting there seeing that patient, letting them go out with their medication. We need to put patients in places where we can have them access different forms of healthcare and in different ways. So when I have things like that, I would, it also just opens up my mind to thinking this is what, and this patient was so grateful. She was like, I cannot afford to pay 700 Rand just for a referral, which I understand we need to, examine a patient, but you can tell so much from a virtual consult. And I've also been able to, I see myself as a modern house doctor. So I can get to step into that patient's home and say, please show me your medicine cupboard. Show me what medication you have. Um, and let me see what you've been using, together. I can tell them what interacts with what. I don't have to unnecessarily script them a medication that they potentially have in their medicine cupboard already and, making them waste more money. So small nuanced things like that is what's been helping our patients, and they've been so grateful for it. In terms of Menintle's question, it's very similar to Melissa's, I think. So when you refer, you can refer to anybody, and then we wanting continuity of care. So when the patient goes to somebody else and they get feedback or they get their results or anything, when I send a patient for blood results, for bloods, I would actually say, please send the report to this email address, and then they will send it back to me. So we're just trying to find different ways of helping that patient stay in that continuum of care. So I'm hoping that answered your question, Minutely. And then Erica asked if the session goes over 15 minutes. So I told you that you can set those slots at 15 minutes, but that just shows you where the slots, how many slots you can have for that day. I'm just going to go to it quickly. But
It's about that's the Erika, that's just like a genetic kind of
yeah,
allocation, because remember when you think about your capacity, remember you must always start thinking in we spoke about it the last time, what's the rate limiting factor when it comes to a practice is your time. So you can work out, so I can tell you if a doctor works 26 days a month, they've got, maybe they're operating 8 o'clock till 5 o'clock, they can see max capacity 183 and 832 consults a month. That's obviously limited by their time, but it's almost impossible that they'll ever get there. They can most likely work on a 70% sort of capacity, and you'll probably get, if you use traditional, just fee for service, patient comes in cash medical aid, you can maybe see 650 patients a month, right? So that's, and this is a harsh reality to look at when you think about, oh, you want to set up a practice. In reality, if you want to do decent patient care, 15-minute slots, that's the most you'll be able to see, is you as one doctor. So you can actually already realize or work out what's the maximum amount of money you can make depending on your rate, and that you're going to be working like a slave, working yourself into the ground. So yeah, so just want to, the reasoning for that, and also just to get you guys to think about um, those elements, right? So the time is a doctor's, um, when you're selling it, it's expensive commodity to
it's
sell.
expensive.
So
Yeah.
so you're selling your time. If that's your only commodity is time, it's very expensive, because you only have so much of it. So yeah, just wanted to
But
add that.
also, the price doesn't increase. It's just to set out those slots. So the slot doesn't end at 15 minutes. It doesn't start at exactly that time. Even if you book me and you book me for 1 o'clock, but I can only see you at 1:15, they on the app there is a chat function where I can actually chat to the patient and say, I'm so sorry, ma'am, I'm running a little bit late. Can I see you in 15 minutes time? So they can still access the consult with that slot that they've booked, but it doesn't go away. It doesn't stop at a certain time. So even if they've chosen 1 p.m. to 1:15, it won't go away after 1:15. It stays there until the next day. So it stays there for about 24 hours. So I can access that slot at 3 p.m. if that's the only time I could probably access them. And then there's also that chat function where we can also just chat if there's anything that I need to ask afterwards. But the session doesn't cut automatically, to answer your question. It is just their designated slot, where like the appointment slot. Like the same way when patients book you to come to it in a traditional setting, you may be running a little bit late, but they can still be seen afterwards. So we didn't make that slot, just disappear after their time slot has reached, has come. You can actually access that specific slot afterwards. Whether it's like 2 hours or 15 minutes later, you can still access the slot. So it doesn't automatically cut and it doesn't increase the price. Sometimes my consults take 7 minutes. Sometimes it's just for scheduling purposes. Yes. So it's just so that that patient knows I have booked my slot. I booked my time. Most of the time, it's patients who are either sitting at their office and they need something quickly and they don't have time to come and see you in person, or it's somebody who's at home and they're very sick, so they're not they're not rushed for time, so they actually are very understanding if you can't see them at exactly that time slot that they've booked. And then in terms of the medical aids, when we had the Android platform, we have used medical aids before as a payment option on our Android platform. But we found that because certain medical aids don't accept it, certain medical aids only charge for the telephonic consult, they don't charge for the virtual consult. Some medical aids will say they cover it, but then they don't cover it. So we've actually now taken away the medical aid option in app. So we've not integrated with any medical aids, just to answer your question plainly. We have Patients have used their medical aids previously to see me, but it wasn't done with the medical aid details on the app itself. That's why we have the voucher system as well. So we can actually we can create the vouchers, and we've sent patients vouchers who use their medical aid, but then we'll bill it with another platform. It wouldn't be done via My Pocket Health because we've tried it and we've tested it multiple times and it has not worked out, and the patients ended up paying for it themselves in the end. So at the moment, yes, we're trying to be accessible, but the medical aids have been a little bit tricky in terms of you also having to be registered with the medical aids. So because this is a virtual care platform, this is multiple doctors on the platform. You can't, if you are not registered with that medical aid, they won't cover you either. So having medical aids added just makes it a little bit more complicated. But there are ways
And
to work around it.
medical aids also not our friends, right? So yes, also they can do that for sure. But a lot of the medical aids don't accept telehealth virtual consults. So a lot
Yes.
of them, it's still, the market is still shifting. So now some of them accept like telephonic, and then it will only cover like 150k. 150k,
Rand.
150 rand. So so ultimately, if you look at the ecosystem, right? Um, we've tried to create, the medical aid is unfortunately not the primary care physician's friend, primary care doctor's friend. They we should have done 150k. Send to me also,
Mhm.
yeah. Yeah, so it's unfortunate that the medical aids, have taken up this role and position they've taken up. I think we asked it on the last session also. I asked the question, if a patient comes to you at a practice, or it's your patient, um, whose customer are they, right? Whose customer is that? If it's a medical aid patient, whose customer are they? And they're not your customer; they're the medical aid customer.
Mm.
It's your patient, yes, but it's actually the medical aid customer, and you are nothing more but a service provider to that medical aid. And unfortunately, yes, the power should lie in the doctor's hands, because we are ultimately the ones delivering the care, and um, it's ultimately there, but it's not, right. You are always going to be dependent on the medical aid paying you, and they can at any time for whatever reason not pay you. So what we try to do is, um, we can dictate whether the market wants to say it or believe it or not, but we actually can dictate how the patients experience care, from a payment type, how they pay, like Chanel was saying earlier, directing them along the care pathway. We need to take that responsibility upon ourselves, as clinicians, and as I guess you could call it, entrepreneurs and business people within the healthcare sector, and take back control of the patient's care journey. I think it's very important. So yeah, so medical aids are a bit of a challenge. But even if you look at the focus as a service model, remember there you're also not really dealing much with the medical aids. Your customer is the GP or the clinic. So it's, if they want to use medical aid, if they want to bill medical aid, that's on them. But you ultimately just going to invoice that doctor or that clinic at the end of the week or the month for all the scans you did. And your transactional relationship, is solely with that GP or that clinic or whoever you did the scans for. Um, so so that's why we try to also and with the virtual care, your only relationship ultimately, if you look at the Go GP model we did on the last session, your ultimate relationship is actually just with Go GP. So you're gonna send Go GP an invoice every month. Say, guys, I did 100 consults. Um, this is what I did. We'll minus the platform fees and whatever, and then Go GP must send you that money. So you have no reason to engage with medical aids with a headache. So ultimately the patient can't see you unless they've paid, and they have all these different ways to pay, from cash, EFT, vouchers, all these things we'll go into now. um, so ultimately for you, your life's simple, because you just say, well, it doesn't matter whether they paid or not, it's not your business, or whether it came through or not, it's nothing to do with you. You just know you saw 100 patients. This is how much your rate is minus your fees. This is what's due, and you invoice Go GP, and Go GP must pay you. It can't really tell you anything else, right? Because you did see the patients. It's not like a medical aid where there's a bazillion reasons for them not to pay. So yeah. So when it comes to medical aids, I think we spoke about it also in the last session. I think it's very important to understand them, understand how they operate,
Mm,
understand what the value
very
proposition is for them,
complicated.
and it's complex, and also understand, yes, they add stress, Erika, you're right, and they are a headache, but when you understand how their business model works, ignore all the fancy advertising and the um, all the stuff we see, the fluff. If you go down to the root of how medical aid works, it is in the business of not paying out. Unfortunately, that is
Mm,
the that is the business model. It is in the business of, it's something called preserving the pool of funds. So they have a minimum liquidity that they need to maintain, and they get audited on that at the end of the year. So it's, as much as they say they act the customer is the patient is their customer, and they're doing this for them, they are also limited in certain ways, because they also have to meet certain. Remember, their financial service business under the Council for Medical Schemes. They have a different, uh, I guess you could call it, scope. We spoke about scope of practice a lot. They have a different scope and a mandate that they need to operate under. And a lot of times, I think providers, us as the doctor, the providers that are seeing the patients, also don't always fully understand what's happening on their side of it. And it's not that it's right or wrong, it's just they operate under certain mandates and things. So, um, yeah, just very important for you guys to really take some time, read up about it a bit more, understand why they do what they do, and how they position in the market, and you'll quickly realize, how you can actually play the field a little bit better with the medical aids.
yeah, but it is a big headache, yes. And for me too, daily. So now we're getting to what I was alluding to earlier. I mentioned work care as a product earlier. And this is something that we've developed. So, like now, I've now explained My Pocket Health. So, that is your virtual care platform where you can use it as your virtual practice, wherever you are, whatever you're doing, whether you are ultrasounding patients all over and or on maternity leave seeing patients. That is your one patient book, you see a patient, you know. But now work care brings us to a way of thinking a little bit broader. It's thinking about groupings of people that we'd like to onboard. It's thinking about giving access to more than just that one person and more than just that one family, but it's a grouping of people, whether it's a company, whether it's an SMME, whether it's a sports group. And I think that we're sharing this product with you that we have developed because yes, it's a way that you can also, we are allowing, I don't know if this is the right word, Chad, but we're allowing you guys to actually make use of a product that we've created and that is already in existence, but also trying to make you think of other ways of, finding other ways of making money and finding ways of monetizing what you have as a gift and as a talent and as a blessing. So work care we've developed in last year, and this is the updated version that I'm showing you now, but it's essentially a personalized direct to provider primary healthcare solution. So we have gone to companies and we have asked them, what are your pain points? What are your issues? What are the things that you actually, struggle with your employees? And if your staff members are in a category of patients who really can't afford medical aid, because if you know anything about medical aid, you'll know that it is actually quite expensive. And a lot of the times, the patients don't actually know what they're covered for. They don't know what they're going to be covered for and if they'll even be covered for whatever they're going to see the doctor for. So we have looked at all of those things and identified some of the things that certain companies, like construction workers and, CCTV installation companies, factory workers, those types of patients who are mostly the primary breadwinner in their homes. And if they can take home healthcare to their families, that is a big win for them, whether they are the mother or the father. If they can take home access to healthcare, and that's what we're selling them, we're selling them access to care. And My Pocket Health, being the virtual care platform, was the first step in that, where we wanted them to say, your patients, your staff do not have to stay out of work to come and see a doctor. If it is something that they are sitting at the day hospital for hours and days, where they just need a chronic repeat on their prescription, which sometimes they don't even get to see the doctor, they just see the nurse and they get their script renewed without even drawing any bloods or checking anything. If we can take that away from them and actually assist with their staff members being at work and being more efficient and feeling that they're being taken care of, we've now introduced them to this product called Work Care. So I'll go into a little bit more detail, but we've spoken to companies and said, what are your issues? And then onboarding them in a customized way. So in a way that is bespoke to that company and to their needs, because not all of them are the same. And at the moment, we do have some SMMEs and some companies on board, and they are loving the service and extending their services and their contracts. But it is this relationship that we've built. So yes, having traditional brick and mortar practices within our ecosystem does help, but a lot of the times it's actually the virtual care platform that gets used the most, because it's those touch points with patients. And to give you an example, I have once seen a patient, the mom, she was at work and she needed me to see her daughter, but the daughter was at school and the daughter had hit her hand with a very hard baseball. And it was lame and it was swollen and it was painful. And she thought the hand was broken. And on the video consult on the platform, I could speak to the mom and the mom could show me a video of her hand, of the daughter's hand, while the mom was at work and the daughter was at school. This was in the middle of the day. The mom couldn't leave work. Her employer was so happy that I could assist while she was still at work and not stressing. The mom didn't have to miss a day of work and the child didn't have to miss an exam. But I could reassure them and say, yes, use ice and rest it and compress it, and send them a prescription for some pain medication. But we could assist them while they were still carrying on with their daily living. I could assist them without having to disrupt anything in their lives. And a lot of the times that was the biggest pain point for the employers. It was things like what people are mostly absent for. So I've just listed them here, because we wanting, the healthier you are, the wealthier you are, the better you, the healthier you are, the more you can work. And we wanting our patients, our staff, our working class people to stay healthy and to stay at work and to take healthcare home to their families. So this is basically what we did with WorkCare. And the biggest things that cause patients to be out of work is it's those minor illnesses like flu, like gastro, like a headache, those types of things. Things like stress. That's why we have the mental health counselors. Things like musculoskeletal injuries, which is why we have the physio. Things like family responsibility. If I can see a child, like a 16-year-old child on their cell phones at home while the dad is at work, that makes everybody happy. So things like that, we're trying to reduce the absenteeism, and that makes employers very happy. And then there's these employee member benefits that we make use of our technology, like you can see the ultrasound device over there. So we incorporate all the different parts of the business, the virtual care platform, and we try to empower our patients with this. So when we started it, we started with a few companies, or one company actually onboarded. And
I actually wanted to
this
say now, Chanel's not saying that first client we signed up for this utilizing it paid us. So remember, our customer is the employer
the
or the
employer.
organization,
Mm.
or it can be a church, it can be a mosque, it can literally be anyone where
Sports
there's
group.
groupings of people that you want to give access to healthcare for. And that first customer of ours actually paid us like 250,000 rand to cover their staff, and then paid
350,000.
350. Sorry, 350. This is now like a while back now, but just as an example, if you remember, I spoke to you guys earlier, and I said, or when I said earlier, the rate limiting factor when you have a normal fee for service offering is time, right? You can only see one patient at a time. So when you create products, remember in the work in the engine rooms, engine room number 3 was social capital. I spoke about workcare. I mentioned workcare in there, the vouchers, all these things. These are all additional products that are available to you guys, that we're making available to you guys under the GoGP model, that you can sell into the market, which is ultimately you selling access to healthcare, which you are going to deliver, right? Um, but it's not going to necessarily just be one at a time. So you can, if you sign up a factory for example, if you manage to, like Erica's, the company Erica, or the GP Erica works for, they do these, what do you call, engineer on duty stuff, no? So that's also something you can offer. But let's say we going in at, you find a factory with 200 workers, right? Um, and there's 200 workers, and you get a factory owner to cover them, all of them, for the month. Sometimes they can subsidize it, sometimes they cover half, sometimes they take it out of the employee's salary or whatever. um but 200 factory workers, 350 a month, that's literally 70 grand. So
Mm.
over that year you can make 840k,
Mm.
servicing that
I
factory.
have it
And
here.
again, it's a function of utilization. So um they're not all going to come all the time, but they can come at any time, and it includes their family members and whatever. But we know from our numbers that the utilization is usually between 26 and 34%. So you will have enough capacity to deal with them, unless all of them decide to come 10 times, which is not going to happen. But um, because ultimately you are servicing the employer, and you're going to have to give them, reports, monthly reports. So there's a little bit of
Mm.
work, but it's
Mm.
not that you limit it only by selling, doing your 15-minute consult at a time. So yeah, I just want to give you guys that, just so you guys can realize and see this is what the market wants. There's enough market for the doctors to go and deliver this kind of service to the SMMEs. Most of these patients and customers, and these companies, they middle to low income people, blue collar workers. They really, if if they're a day out of work, it's a big deal for them. And
It
like
costs
Chanel
them
said,
more
most
to
of the
be
time
out of work.
it costs them a lot more to be out of work. And ultimately, if you think about let's think of a phenotypical person who's a blue collar worker, where they stay, their family dynamic. There is a definitely a phenotype, right? And if you look at all the social determinants and the psychosocial stuff, um, those men, usually men, are usually the most unhealthy. They're the breadwinner, the primary breadwinner. They usually have some form of chronic disease, non-communicable disease. They they ultimately, uh, I guess you could call, uh, they're incredibly valuable to that business for the most part because they've usually been there for a long time. So if they are unwell, it costs that
Mm.
business a lot of money. And unfortunately, if these guys are unwell, they're obviously the breadwinner. So the family
It's
loses
the
that.
family.
But if that father is able to bring home any form of healthcare to their family, so to know if that kid knows or that wife now knows, if something happens to me, I know that's my doctor. I don't have to go sit in a state clinic
Mm.
somewhere. Um, they just know that that's where they must go. It's such a big win and it's such a big value add to that family, that it makes the employer look very good because then the staff work extra hard because the employer cares about them. So you see, it's everything is about value proposition mapping.
Mm.
What's the value for who?
Mm.
And that's how you kind of navigate your way through, getting customers on board and so on. So this product, what we're doing is alongside with My Pocket Health, we're making workcare available to you guys. There is a commercial element to it, as you guys saw in the last session with GoGP. We will basically give you guys access to the product. You guys can sell it. We'll give you guys rights to sell it, and push it. These are your customers, not our customers. You push it out. We will then just work on a commercial model where we will probably take a percentage or something on as a fee, I guess you could call it, for utilizing the brand and the IP and whatever. So that's it. But it's not going to cost you. We're not giving you, not saying, okay, guys, you must buy from us. Whatever. We give you the framework, the tool sets. It's gonna let you guys generate good money and it's gonna be recurring revenue.
Mm.
If you're getting, you can start small, get 5 or 10 companies, 5 or 10 staff members on, and before you know it, you'll be sitting on 100 people under management. I call them
Mm.
patients under management, um, and that's how
Mm.
you build it out, right? And it's one of those engine rooms we spoke about. But yeah, Shanalkin, I think Sean just wants to give you the. So that's what I'm trying to show you guys. Like, it's super simple. I know Erika's been doing it now with her business, but it must be you guys. Nothing stops you guys from having your own customers like that. You don't have to go do it for another GP, or
Mm.
you can literally
And do
be
it by
that.
for yourself. Yeah.
You can literally do it for yourself, and do it under this business, under this model, under the Go GP model. Um, and the math makes a lot of sense. So it will take some. It's going to challenge you guys because you're obviously going to have to go out and sell.
Mm.
And I think the
And you
selling
think
part is what
differently.
scares.
Mm.
That's what scares, I think, most people. But I think Chanel is a testament to the. I think Chanel, the selling
Yeah.
part. I think we need
The
to just.
selling,
She's a testament to the.
I would rather see a patient than go and do a sales pitch of some sort. But I've actually, the more we've onboarded, the more confident I've been getting and the more exciting it's been. But for me, because as doctors, we don't really have to sell ourselves. Patients trust us. They come to us and we do sell ourselves when we want them to come back to us, but we've never had to prove to them that we are this and we can give them this, and we've never really sold, except when Chad likes to use the example of when we sold our referrals to specialists and how well we could do it. That was actually us practicing our selling and our sales pitches. So we have had a little bit of practice, but I think as traditional doctors, it comes a little bit unnaturally to us, and for me, I was very scared about that. So me giving you this, telling you this now, and having a few companies that I have actually onboarded by myself, gone to the meetings, onboarded them, made sure that their reports come on time, looked after their staff members. At one point, one of the companies had 20 staff members, but I had patients under my management, which were 80 patients for the one company because of all the family members who were added to those packages. So it does make actually a lot of sense. So that's why I just showed you this kind of the quick math here quickly, that if you have 10 companies onboarded and each of them, let's say they, for example, 15 staff members each, and they're paying you the middle premium one of 5.99 per month, which includes these things, you can actually be making, good money per month. So you can be making like 89,000 to be looking after 15 families, as an example, which could lead you to having, like, if each of those 15 people have 2 to 3 people added to their package, that could be like, 50 people that you're actually looking after. So we wanting to just show you to think a little bit broadly and not just, yes, my pocket health is that, fee for service, patients book, patients pay, patients see you. But with the workcare products and these things that we've on board, that we've added to our company as a whole, we've actually seen great benefit to it. And also we've seen, the monetary value that's actually been very good. So I don't know if there are any questions about this. But that was,
Does it
yeah,
make
what I wanted
does
to
it
share
make
about the
sense?
workcare.
Does it make sense to you guys, right? It's like, I mean, the idea is just that it's a tool for you guys to use. There are the other product or the other offerings that we've kind of brought in alongside the virtual care as a platform is, we spoke about it also in the session, the vouchers. Um,
Mm,
so basically, the vouchers are a mechanism within My Pocket Health that you guys can use to make care available to more people. So, for example, if you remember, we spoke about making healthcare accessible to people maybe that maybe can't access it, or lesser, like lower income areas. You can use the vouchers as a means for people to pay for the access. So remember, I said never do anything for free ever. Okay, yes, you can. Look, I'm not saying never is a bit harsh, but understand that your value lies in that transaction that must happen is your IP and your experience and your knowledge must be transferred to somebody else for a monetary exchange. And
mm,
if you want to help communities and you want to go and do, work in lower income communities, perfect, 100%. We all want to. I do it too. Chanel does it too. But you need to find someone to pay for it. You can't go do it
mm,
for free. So I get a bit frustrated when I see. I get it. It's a very heartfelt thing, and it's. I feel you can create more value when you're pouring from a full cup. But when I see in KZN and these areas, where the unemployed doctors are doing these free screens and things, yes, I understand it. But who are you doing that for? What is the mechanism there? Because the patients are getting free healthcare paid by taxpayers at government facilities already. Um, what is and a lot of them are doing it in protest, in a way, from what I understand, of speaking to quite a few of them. It's an element of protest. However, they would be more mobilized. They are more empowered if they can go to businesses around the areas instead of doing it for free. Go to businesses around the areas and present an opportunity for them um, to buy access to healthcare that they can go and deliver, because any business is incentivized to make people healthier. Because if people are healthier, they are more
over.
likely to be working. And if they are working, they're generating an income. And if they're generating an income, they're more likely to spend their money. And where do they spend their money? They spend their money at retail businesses and so on. So it is in their best interest to make sure that the communities around their businesses um, are, are empowered and healthy and such. So things like the vouchers, how that works is we've created a voucher creation platform, if you want to call it that, which is numbered and etc. And then you guys can come to us and say, Chanel, I found a couple of businesses in this area. They want to buy 1,000 consults for people in the community. Okay, you give them a price. You said, okay, I charge them 400 Rand a consult or 250 a consult because there's so many. So you come to us and you say, Chad, this is what we want to do. We will then say, okay, we'll issue you 250 voucher codes, right? And you decide how you want to sell it to them. Either they can pay you up front for it, they can,
Which we've done before,
offset.
by the way. We've sold
You know,
voucher codes
exactly.
up
That's what I'm
front.
saying. We sold. I'll tell you guys about Zlato now, but we've sold vouchers because remember the voucher is just um, you. It's a mechanism to get access, right? So you're buying
Mm,
future access to healthcare. It's
mm,
just that we've created a product that someone can actually pay for, that
mm.
is basically entitling someone to the care that they're gonna get. So you can buy 1,000 and give it to anybody, to 1,000 random people. You can donate the consults to them. But the fact is, they've got a voucher that they can come and redeem, which is gonna give them access to healthcare. And the same thing you can do with NGOs. You can do it with, if you've got a rich uncle who needs a tax write-off or something. There's many ways that you can come up with a way for someone to pay and give and make a strong enough case for someone to pay for healthcare access for
Mm.
somebody. Um, so again, the vouchers is just another mechanism for that to happen. And then there's things like, so you'll see when you go on the platform, if you're on the patient side, from a payment point of view, there's different types of ways to pay. You can either do card, cash, card, EFT, those types of things. Then there's two specific ones called Zlato and then corporate. So Zlato is also a very interesting thing. Again, just for context for you guys, so you can understand the types of deals you guys can go do. Nothing stops you from doing these types of deals. If it comes your way, go for it. But Zlato is basically a platform
They
that
incentivize
is,
good deeds.
yeah. So it's a blockchain based platform, and they really, by which analysis, incentivize good deeds. You basically get rewarded in something called Zlato, which is basically their
The
coin type
currency.
thing. It's their currency on the platform, and it rewards you for doing good things like, you know, there's different partners
Picking up
on.
litter.
We decided to be one of the partners, so we are a healthcare partner. So what we do is we give them um, little questionnaires on like CPR and headache and simple patient education stuff, and they complete those things. They're obviously equipping themselves, they're learning something new, and they earn a Zlato. They, like Chanel says now, they will go and pick up dirt. There's another partner that's incentivizing people, picking up, cleaning up, and not littering and whatever. So, and gardening and all these plastics and whatever. So all these environmentally related things and self-development things allows them to earn these Zlatos. And we have decided on our platform that we will accept Zlato as a payment mechanism. So ultimately, we've even now allowed people to get access to healthcare without paying a
Without
cent,
paying
but
for it.
they're earning it through these Zlatos. The difference is, though, that um, a partner at Zlato paid us in advance for X amount of consults.
Mm.
So we then issued the Zlato then issues the coupons, and they are then able to then transact a certain amount every month. So if you just think about what we're doing, look at what we're doing, right? We're creating ways for people to access care.
Different
That
ways.
is the long and the short of it, right? So my pocket health is a transaction medium which allows people to access you. How you go and position that in the market, we've given you some guidelines and things we encourage you guys to do. We're giving you guys products and tools to go and push. But ultimately, if you find another way, additional ways or new ways to do it, then you do it, right? You're just gonna use the platform as a transaction medium for you to do it. Okay, so it's hopefully gonna start sparking some ideas in your head where you
Mm.
find yourself like, if you want to service a certain level of the market, like maybe the higher income communities or so on, there'll be a different mechanism for my pocket health or these types of things in those areas, which is completely different to what it would be in, say, the Cape Flats or lower Phoenix in KZN, lower income areas. It's going to be very different, but that's your reality, and that's the offering you want to do. So yeah, so Erica just asking, benefits are renewed every month. Yeah, um so basically, yeah, every month. So if you look at it, right, so we obviously have the hybrid care model. We've got the in person and the virtual, right? So what you could do is, because trust me is very expensive and not worth it right now to set up a traditional GP business. Remember, ours is not traditional in the sense because we built this scalable commercial model and things. But um, for you guys to want to do it, nothing stops you, like I said, from partnering with a nurse or partnering with or community health worker to equip them. You can do that stuff, right? And you will be able to cover them, because the more customers and more people you get on board, the more revenue you'll be making. You then can decide how you want to, and you'll chat with your accountant, which you'll be introduced to quite soon from sme.tax. You'll have mentoring sessions with them every single month. You can discuss, okay, I'm now making this much money. If I bring in this service, it's going to cost me some money. However, it's going to open up this market and that market. So it's going to become a nice dance you're going to do as you evolve, your business grows towards the 200,000 and a month we all really want you guys to make. Um, you can then decide what services you want to offer, which resources you need. So yeah, so those benefits basically, I think Chanel, those
It's
like the B12 shot is not
yeah.
it's not
So
monthly, right?
no, no, it's X
Seasonal.
amount. It's X amount that's made available to the family members or the staff members or the members, the people that are added in there specific. So if I have a company of 15 staff members, and they want, so remember, like I said in the beginning, it's completely customizable. So if the company says, I don't think I want the pap smears added, can we add maybe just extra physiotherapy sessions, because I have construction workers or factory workers, and they sit, and their lower back is an issue all the time, so they can customize their plan. So these benefits aren't renewed every month. It is valid for 12 months, so it's valid for the year. So if they are available, if they want like the vitamin B12 and maybe the flu shots, that's one um, shot per member per year. So it's a contract that we sign with them to actually, have X amount of benefits for that family for 12 months. And whether they add up to 3 members, dependents added to them, or one, or it's just them, it depends. So it will be shared amongst the people that are added to the dependents, but it's not renewed every month. It's a 12-month cycle, and then we renew it at the end of the 12 months. Yeah, so that's that question. And then in terms of having other doctors see those patients that you've onboarded, you would
Those are your
obviously,
customers.
that's
Those are
your
your
customer.
customers.
Yeah. So, and again, like Chad was saying, if you involve more people, that's going to be more people that you have to pay. So those people need to be paid for the services. And when you if you see the payment options and that there was a corporate option, those staff members, if they have maybe the premium plan, the premium package, they get unlimited virtual consults. So then they go through with that button, so they can actually click corporate and book the doctor. If, however, they book another doctor, you actually are going to be that company's doctor. So it's like you are looking after them, and you are, looking after their healthcare and all of their healthcare needs for those 12 months. So when you onboard them, you will have to have a session with them and say, I am the doctor that you choose. And you can, I mean, they wouldn't want to see another doctor if you are the face that they are familiar
'Cause-
with.
Yeah, and they'd have to pay, right? So with you, it's already been paid for.
Yeah.
So that's the reality of it. So
Yeah.
if they're your patient, their doctor, when they click corporate, our system basically will ensure that only people who are actually corporate customers can see you. Um, so that will happen. That's how that transaction will happen.
This
So
makes you
yeah, so
very
I think
close to that 200,000 per month with just 10 companies.
no, you can. And so Chanel, that's obviously the overall
I
income
know,
from the focus
overall.
scanning,
Mm,
plus the locuming if they still feel they
mm,
want to do the locuming, plus the
mm,
virtual care, the fee for service, plus. So
mm,
just look
mm.
at the broad spectrum of revenue and income generating uh mechanisms you have now. You now no longer just have, oh, I am
A
Dr.
locum.
Manindle, I'm selling my 15 minutes of time. That's
Mm,
that's the key takeaway, right? If you think about it, you equipping yourself with a mindset, tools, and a commercial framework and partners, everything we did on the business canvas that gives you all these different opportunities to generate income. Yes, some they may not all work perfectly well. Um, if you look at with the virtual care side of it now, you're going to start with your fee for service. The cap, if you think about numbers, you're going to decide how many fee for service consults you want to do a month.
mm,
That's going to be your 15-minute slots, and that's going to be every transaction. If you want to aim for 100 a month. That's going to take up how many hours a day of yours? Maybe it's 15-minute consults. If you're doing 5 a day or something like
mm,
that, or 4 a day, that's not even going to take an hour of your
mm.
time.
Yeah.
If you get it like that, then if you're doing your focus scanning, you might have some travel time involved, but maybe let's say you're doing 10 scans a day. That's a 20-minute, 15, 20-minute scan. Maybe you're doing 10 scans across 3 GP practices. So quickly, as this thing builds momentum, you're gonna start building up these revenue streams. Now you maybe get like Erika has there a few companies in mind. You sign up one or two with 20, 30 staff. Now all of a sudden they're paying you, 350, 500 and a month each. Then you're looking back, you're like, hey,
All
but
adds up.
now it all adds up, right? Before you know it, you're eating your 200, Manisha. I know that's what you're pushing for, which is good. That's what we want, right? We want you guys to push for those numbers because um, ultimately it's very possible. It's not a pipe dream. It's not a it's tangible in front of you guys with all the tools. It just requires a bit of getting stuck in, a little bit of being uncomfortable initially as you go into
Mm,
the market. There will be some no's, there will be some rejections,
mm.
um, but ultimately you guys are going to be equipped with a business, and you guys are going to be going through the poker side, the clinical side soon, where you'll also feel a bit like, oh, this is a bit overwhelming. The same way Chanel says, she's obviously was a traditional doctor. Selling wasn't really a thing, but I knew that she could sell for like a very good salesperson. But she's selling without selling, and that is that social capital that I keep reminding you guys of. Doctors and Chanel, you can testify to the fact that doctors have social capital.
Yeah.
People,
Yeah. And that's why
people love.
yeah, that's why I'm so excited for you guys to, I don't want you to sell yourself short. You don't actually see what you have. And that's why I'm excited that you guys have joined this project or initiative, because we're trying to remind you, you are actually, quiet. You actually, you can actually you actually can do amazing things if you're just given the opportunity to think a little bit more laterally and a little bit in different streams of income. Like, you don't have to just be doing the same thing every single day. But I'm hoping that these things open up, because this is what it did for me. So I'm a testament to, being the first guinea pig of this, that it actually,
Chanel was basically the first Lola doctor, basically,
yeah.
to
So
to to what the model is, because Chanel has all the revenue streams. Engine number one, she's doing Pocus. Engine number two, she's doing the virtuals, plus workcare, plus some other stuff. Engine
mm,
number three, she's now doing talks. She's doing so everything. I'm telling you guys in the model. Um, is how it evolves. I mean, it's proven. I've proven it now with Chanel. So, um, I just want you guys to remember your social capital. Please remember when you go to
yeah.
bed at night, and remember that nobody else undervalues doctors as much as other doctors. Only the
Mm,
only place in the world where you are not valued in inverted commas in according to the because all the other doctors are at the same level. The moment you step out of it, you step into a discussion where it's a commercial discussion or it's another business, you are the only doctor there. And trust me when I tell you, you guys will have higher ground, right? Even if you don't think so, you are there and engaging from a position of influence. Um, we are doing this thing. I know not everyone's Christian or anything like that, but we have this thing where we it's something called Kings and Priests, and it's basically about you need to demand or command your position in the world. From our perspective now as Christians, it's obviously now as a Christian, and that means you have to speak and do and live and not be shy about what you believe in. It's not like blurt it out to the world, but just live and do in a certain way. So like for me, it's a case of speaking about things that relate to like Christianity and my faith and how I deem the world in rooms like boardroom. Sometimes I start my meetings like that nowadays. So where I speak about that first because it's a journey I'm on. So in that same way, you as the doctor, when you're engaging with the market, go put yourself out there and position yourself, as who you are.
Don't sell yourself
And
short.
short, yeah, exactly. So use the tools. There's a lot more that will go into it as it evolves. This session for me was just very important so you guys can see what the platform looks like. Remember, step one for this week was for you guys to sign up and register, go through the process, set up your virtual clinic, and then hopefully find 10 people in your immediate friends and family. That's where you start getting that first friend and family or cousin that asks you, what's wrong with my finger. You say, go book me there. Go book a consult with me on at my virtual clinic. So get 10 or so people to sign up. It's your patients. You need to just go through the process of, I think, just having someone do it. And then you don't have to have a consult book first, but we really want to see you guys bringing some customers onto your, and it can be normal, just everyday people. um and then, Ocean, I'll just comment on the practice number then,
Yeah. Yeah.
because we'll get to that now quickly. But yeah, so you guys must just set up your profile, get going, get people on board. The you guys must be shifting now into taking responsibility and ownership. You are thinking as an owner, an independent practitioner, your business, you responsible. So that shift must happen now on the virtual care.
Yeah, I just want to comment on the uploading of the documents. You will be verified by me if I see that you have actually uploaded your documents that we require on when you registered for Hlola for the Go GP program. So if you've uploaded your HPCSA certificate, those things, then you don't have to re-upload it to the platform. You do if you're not part of the Hlola program, but because you guys are, you don't have to re-upload it. So I will check it where you have uploaded it, and then I will verify you. I'll verify you once I see that you are, registered and you're not a bogus doctor and you're an actual doctor and you're registered with the HPCSA. Then we will verify you once I have verified you. So if you've registered, you don't have to upload the documents, but it will say that your documents are are being verified. Then I will check on the Flora side if your documents are there. If they're not, then I will reach out to you and tell you what we need. Then I will verify you. Once you are verified, then you can start, accessing your bookings tab. Then you can make yourself available for as many times as you want, whenever you want, even if it's after hours, even if it's Sundays, because patients need doctors on Sundays and there are no doctors available. You decide, you see where there's a market for you and for in terms of your lifestyle, and you can go crazy and put yourself online. So once you are verified, you will then get access to making your slots available. In terms of the practice number, this is your virtual practice. So you do need an independent practice number. So when it's a very simple process. You just do it with a BHF. You go online, check what they require. You pay the fee. It's really not a lot. I'll be lying if I tell you how much it was, but I honestly did mine in like 2 minutes. and I got my email with my practice number within the next week, and you have a practice number. So it's a very simple process that I can send you guys links to afterwards if you are unsure of how to actually register for the practice number. But it's a very quick process, quicker than I actually expected it to be. But you unfortunately do need a practice number to practice independently. And this practice number is different to your HPCSA number. So your HPCSA number is your MP number, but you do need a practice number that is registered with a BHF. Okay. So you do need to do that. And then that's another thing that's a requirement to actually be on the platform. And then Meninhle is asking, how do you cut down the consultation time to 15 minutes? I understand. I understand that you can't really. You'll actually be surprised in terms of like virtual consults. They actually go very quickly. And if you have been seeing patients in brick and mortar traditional settings, you'll see that you can actually get enough out in 15 minutes. But it definitely is something that will come with time, and to build the rapport and those things, I understand fully. But you will see that the more you do it, the better you actually become. Honestly, this is now in terms of virtual consults, but my virtual consult timing has been like an average of like 7 to 8 minutes, because it's that simple. It's simple things that patients are like, I'm fine. I just need a prescription for my contraceptive. Please, can you send me the repeat? And we'll send the repeat. And I'll say, please just send me your blood pressure reading once you go to the pharmacy. And they do that. So it's honestly been like, it's quicker. You can get the most out of it, actually. You just think it is too little time. But yeah, the more you do it, the better it will become. Are there any? I see you guys are typing. Yeah.
Can I just make one last comment before we can wrap up? I just want to mention something called managed care. So this is another, again, you'll see we've created lots of different products for patients to access healthcare in certain ways. So managed care is something we developed, which is specifically aimed at chronic patients. So that's basically a model where you take someone with a non-communicable disease or like hypertension, diabetes, and you create a managed care program for them. So it's basically an annualized approach. So someone as a starting point and an end point, you have a target in mind, and you create a care plan for that person, which involves maybe you and a physio or a dietitian or whatever. So it's basically a product or offering you can put to. So let's say you've identified. This is not separate to Workcare. Remember, Workcare is for groups and organizations. But let's say you've built your customer base up now to maybe 200 people, and you identify in your 200 people, oh yes, 40 people with hypertension or diabetes. You then can take this managed care approach and say, guys, all 50 of you, I'm going to create a managed care program for you, and you build a bit of a community with them. And you can even so you guys are all getting a tablet, like a Samsung tablet with, you guys have to put your SIM card, your own SIM card in. But that's going to basically be your practice tablet, which is for you to use. You'll do your scanning on there. You'll put your virtual care on there. You'll put your WhatsApp number on there, your business WhatsApp for you. But you can basically create a little WhatsApp community if you want to with your 40 patients. And you can say you guys you can set a price. Let's say it's $3.99 a month or whatever the number may be. And you basically build this managed care community where you let them check their BPs every day. You get them to encourage each other, whatever. But these are the things that are ultimately going to help these patients improve their baseline health from a chronic disease point of view. So that's another product offering you can create and you can push. We've already created it, but we'll give it to you guys to use. But I'm just giving you as an example of what you can do as you're building up your customer base, right? It's you and your patient. It's not anyone else's patient. That is a covenant relationship between you and your patient. How you deal with them and how you operate with them ultimately is just for the patient's best interest at the end of the day. Um, the way you commercialize it is where your value proposition lies. So for them, it's a big thing if they know they're getting specialists or not specialists, they're getting special, in inverted commas, special care or um, more, what's the right word, holistic care or personalized care from their doctor for their diabetes. That's a big thing, right? Because most patients, the only touch points they get is their 6 month follow up, and maybe when they have some hypertensive urgency, they end up at the doctor. But if you can use the virtual care as a mechanism um, to do managed care, which is ultimately chronic care. So just something to look at. Same thing applies to things like old age homes. You can go and sell offerings to them with specific old age home related stuff, etc. So the market is there. It's there for you guys to take. This community is supposed to be that, if like even in the WhatsApp groups, if you come up with an idea, post it in the idea. The beauty of it being doctors from across different areas and different realities is the market is so big. No one, even if I tell Erica, for example, or I tell Dominique, or I tell anybody to do, I'm gonna do this, it's not gonna compete with each other. Like I can go and do the same thing where I'm operating, because ultimately I'm not operating really in the same area. You and your partner are going to be operating together, so you're going to be attacking things at the same sort of in the same way, um, and you're going to be sharing these ideas. But it's great then if someone in Joburg picks up from something that someone did in Cape Town and then tries to do the same over there, because you have your own reality. So the community we're building here is really powerful. And the more we engage with each other, the more thoughts we have, suggestions, questions, ideas, the better. Because I learn from you guys every single time we speak, right? So um, yeah, I think I just want to encourage that for you guys also. But yeah, Manisha, we're gonna have a lot more time to do this as we build out over the next year and a half, 2 years together. Because that's really what we're doing, right? We're gonna have very good relations together, building this thing out. So we'll get into all the mindset stuff as we go. But yeah, I think we've covered most of it. I love the questions. Thank you, Chanel, for guiding us through the session. Um, if there's any thoughts or comments, pop it in the chat. We'd really
Yeah.
like, if anything comes up afterwards, you can put it in the WhatsApp also. I'll pass it. I'm gonna add Chanel to the chat also. Um, but yeah, we also as excited as you are, Erika. Really, it's a really a big thing for us. Having as many doctors with this mindset out in the world, because ultimately the patients need it. I think more than you guys realize.
Yeah.
They are
When
begging
we
for this.
expose them, yeah, when we expose them to the things that we've actually created so far, they literally say like, "Thank you so much. This is something that I always wanted, or something I never knew I needed." Or so we really want. Imagine more people like that, and more providers actually providing services like that. That just changes somebody's whole life. I think the world will change. So I'm very excited for you guys to go out with these new mindsets and everything that you've been learning, not just this part of it. But thank you for having me, and I am very excited for what you guys are going to do and what you're going to come up with. And you guys are going to be amazing. Just don't sell yourself short, okay? You guys
Yeah.
deserve to be paid for things, and be making the paper, which is something that I think we struggle with, because as when we training to become doctors, we almost trained to become public healthcare workers and not told how to actually monetize our skills and our services that we can provide patients with. So I think this is an amazing way for you guys to learn how to actually make money with what what you inherently have, what you can naturally do, but nobody's been there to hone it for you. So yeah, I'm very
and
excited,
that's
and I will thank you
and
guys.
making that money is, I know we use the term making money, but it's a value exchange, right? You are giving value to someone else for what you're doing. It's not like money that's wasted or anything like that. It's a value exchange. So you have value, and that value
Yes.
is worth a lot. And for that patient in that moment, it is everything to them. In that exact moment that they're engaging with you, that is the most important thing for them right then and there. For you, maybe it's just another patient, but understand that that transaction that's happening there, it's not a grudge transaction. They are grateful for what they are receiving from you. Okay, so um, I think that's a big shift that I was saying now about the public health shift to the private sector. It's not that it's about the money per se. It's just about the
Thinking
exchange of
differently.
and the
Yeah.
exchange of value that's happening. What is the exchange in the public sector? The exchange is very different there. There you are service selling your time into the public sector. You the customer is the patient, who's the state patient. But what you are selling there is very different to what is happening in the private sector, and that shift needs to happen in your head. So yeah, so I think it is happening. I can hear it in the enthusiasm and the questions. It's moving away from I'm a little bit scared to do this to more, oh wow, actually I'm excited to do this. I can see it. And that's really like the most important step is that you guys can actually see what I think maybe I see and have always seen when I look at doctors, which oftentimes, and Chanel again is testament to that, the doctors don't always see it themselves. Um, so yeah, thanks guys.
Yeah. Thanks,
We'll
guys.
keep there's obviously the information will flow and the comms will flow as we go. There's obviously the detail around all these things as we get into the the setting up of your companies and um you know um once you're on the platform, get registered. All the and even now in this week, you need to start looking at speaking to some of the GPs, etc. So it's all about putting yourself in the, I guess, initially uncomfortable position of doing it, um, and then as we go, we'll share more and more information with you. Once it gets to the day you have your first potential, for example, working client, it's a text away. It's not like it's going to be difficult we'll navigate it with you. If you even want help in pitching them, remember we also incentivized to give as much support as possible, because the more of you guys out there comfortable selling work here, the better for our business too, right? So remember, nothing is free. There's a value exchange both ways. So um, we will put in the effort with you guys, like I did with Thea and the other cohort, helping him, buy a practice. A year ago, you never even have thought to do it. He literally told me, he's like, Chad, I would never have thought to even think of making an offer. And that's ultimately everything to me, right? The fact that he was actually thinking about it in the first place, and now obviously helping him with it. So and again, I'm not a charity. I do not. There's nothing. I'm not an NGO. I think I did that on with Marlon on the caller. So it's transactional for me, but I need you guys to move to the framing of saying it's a value exchange. That is very important for me, that you guys understand that
Mhm.
what you are engaging in from a transaction point of view is an exchange of value. There's value that you are giving to someone, and for that they are giving you money. That's just the transaction medium here is money. In It's one of the ways that people are paying for value. There can be other ways that they pay for value. Could be with time, it could be with access, etc. But just start putting yourself in the mindset of saying, I'm entering the world as a doctor and I'm looking for ways to exchange value. And sometimes it could be for money, it could be for other things. Okay, I don't go all the way to the other side for other things, but you get what I mean. There's definitely a lot of value on the doctor side that you are offering the market, and I want you to go to bed knowing that tonight you have an immense value to the market. Okay, so yeah, that's it from our side, I think. Chanel, anything else from
Yes.
your side?
Yeah. No, I think I said everything I wanted to. You guys are valuable, so just go to bed with that thought tonight. Okay. I will please contact me if you have any questions about the virtual care side, and if try to add me to the group, then I
Yeah,
will,
I did the
be
group.
there
Yeah.
because I didn't get a chance to check who has actually been of this cohort who's actually registered yet, but I'll check that tomorrow, and then I'll reach out to you if I need any other documents so that you guys can start setting your slots to be available. Okay. Thanks, guys.
And
Good
then
night.
and then you must get your first 10 your first 10 people to sign up. That's
To
like,
sign up.
if you guys get that right, I promise you the next 10 are gonna be so easy,
Yeah.
because it's just that first, just getting yourself to go out there and say, hi, if you need to see a doctor, you can consult me on here. Here's my link to my sign up to this thing, and these are my rates. That's the biggest, I think,
Yeah.
block barrier you have to get through. That's why I'm pushing you guys so hard to do it.
Just start. And then
Just
you'll flow.
start. Yeah.
Okay. Thanks, guys. If there's
Cool,
nothing
guys.
else.
Thank you
Yeah.
very much.
Thank you.
If no other questions, yeah, we can wrap it up.
Good night.
Night, guys. Night, Chanel. Thank you. See you now.
Bye.
Cheers, guys. Any comments or thoughts, you guys can pop it in the chat before you leave. But yeah.
I think everybody said thank you already. Okay. Bye.
Bye.